Now, in terms of asthma, the reason why chiropractors commonly say that the asthma can be relieved is that it can really help with the posture through the adjustments. So for example, let's say a child has asthma and it's this child here. If he's really hunching down like this, you can see how he's like forward, his head's forwards and he's rounding out with his shoulders and even possibly some scoliosis. As that happens, his ability to expand is going to be limited. So in terms of breathing, it's going to mean that, for example, difficulty breathing because of the posture. So if we can get his posture better and get him more from this type of transition from this type of posture to more this, where he's more upright, his head's more level, and his shoulders are not tilting, so for example, to help with the scoliosis here, then it gives him a better chance that the chiropractor can help. Okay, so there's a couple of ways that we can help with that. One is more structural, looking more at the structure in terms of the positioning, the posture, and the other one is through the effect on the nervous system. So when we do an adjustment, we essentially want to have an effect on the autonomic nervous system. Whenever you have asthma, what happens is you get vasoconstriction of the bronchioles, and that then causes like a compression or a constriction, obstructive feeling. And that's where the patient can start to feel obstruction in terms of breathing. So they have difficulty breathing. And then that leads to wheezing. So one thing that we want to do, especially for asthmatic patients, is to make sure that their elimination is good and they don't have toxins in the body. And one way that we can help with that is to adjust so that we can improve, especially in terms of bowel function. Because if the bowels are not functioning well, and for example, the patient is, or the child is quite constipated, then it means that there's going to be toxins in the body and that can remain. And if that remains, then it can start to affect overall nervous system function, and especially in terms of the breathing. So by getting proper elimination, so to reduce the constipation through the adjustments, and that can have a much better effect on overall breathing from the adjustments. So it doesn't always mean that, for example, the nerve here, like this area here can get affected. And this, in terms of the nerve, if you trace the nerve function, it goes straight into the lungs. It can be anywhere in the body that has an effect. So sometimes even adjusting through here or even upper can have an effect on the lung function, okay? Because it's overall posture as well. So our effect is, as we do an adjustment, we essentially want to improve nerve function. We want to get the nerve working as well as possible. So it gives a better chance for the arterioles to expand and dilate, which is what we really want, especially if someone's bronchial is constricting. It's more that we want to get the whole nervous system working as well as possible through the adjustments.